think we can start because we promised 12.
Yes, sir, we can start. So thank you, sir. So let's start the session. Uh, good afternoon, good evening. Welcome all, uh, dear listeners, dear attendees of this very important session on of today's session is, and it's today's insightful discussion on one of the cornerstones of any noble profession, professionalism. I'm Dr. Mubashir, your host, and we have the privilege of having three distinguished professors or panelists with us today, Professor Shabi Haidarzadeh, Professor Gohar Wajid, and Professor Yadul Lazarizadeh. In the complex landscape of medicine and academia, professionalism serves the compass, guiding ethical behavior, compassionate patient care, and overall integrity of the profession. Today, our esteemed panelists will delve into various aspects of professionalism, sharing their wealth of knowledge and experiences. So buckle up for an engaging 50 to 60 minutes as we explore models of uh, physician-patient relationships, the influence of society on professionalism, the assessment of professionalism, professional identity, and much more. Without further, so let's jump into this enlightening conversation on professionalism. And with that, I would like to request all three panelists, starting with Professor Shabi Haidarzadeh, followed by Professor Gohar Wajid and Professor Yadul Lazarizadeh, to introduce themselves and say a few words about professionalism, and then we will start the podcast. Over to you, Professor Shabi Haidarzadeh, sir.
Well, thank you, Mubashir. It's been wonderful to meet Yadul Lazarizadeh and Gohar Wajid, my old friends, on the podcast, which we are starting as the beginning. This is the first podcast for SIVU, Sadiq International Virtual University. So it's something new for me, at least. I'm sure other people have had more experience. So I'm basically an otolaryngologist based in the UK. Where I work with the NHS on flexible hours basis now. I also I founded this Sadiq International Virtual University at the peak of COVID era in 2020. And thank God and the blessings of all your friends and scholars from across the world, we are progressing very well. This is our fourth year and we're really flourishing, conducting webinars, workshops, courses, and we've published a book with the Springer, which is coming out next in March, called Global Medical Education. So with that, I think we can open the remarks and say that medical profession is a wide subject and we need to discuss, elaborate it through the learning experiences and the experiential learning, that probably is a better word, of scholars like Gohar Wajid and Yadul Lazarizadeh. What I mean by professionalism is that it's a combination of different factors, starting from demeanor, the dress code, the mannerism that you learn from school and to home, other places, and then it goes on to various modalities of patient-physician relationship and talk about the contextual basis of professionalism in the modern era. And then we talk about other things. So with this, I'll hand over to Gohar Wajid. Gohar Wajid is the famous WHO consultant. He has more experience than I have. Over to you, Gohar.
Thank you so much, sir. I certainly don't have more experience than you. Always learning from your vast experiences. But thank you so much for your introduction. My name is Gohar. I work for the WHO in the EMRO regional office, primarily looking after education and training of health professionals or health workforce. Any country needs efficient and effective health workforce to deliver health services, and the entry point to any health workforce is education and training of the health workforce. So I look after the education and training of health professionals, what we call health professionals education. That's what my job is. And here, whatever we will be, at least I will be saying, the disclaimer is that it does not reflect the policies or the ideas of WHO. Rather, it is a personal on one-to-one discussion only for the sake of learning from each other. Thank you so much, sir.
Over to you, Professor Zarizadeh, sir.
Thank you, Master. I am Yadullah Zarazadeh. I'm a physiotherapist by background, and I have been working as a professional of rehabilitation for more than 30 years. And as a university lecturer, I have been in the same time teaching in medicine in medical school. I am the head of Department of Medical Ethics and Medical Education at Kurdistan University of Medical Sciences in Sanandaj, Iran, and I did my PhD in medical education. I finished it in 2009 at the University of Newcastle upon Tyne, UK. I would like to today stress on the challenges of assessment of professionalism. And if I want to have a definition of professionalism, first, I would say that it is the habitual and careful use of communication, knowledge, technical skills, clinical reasoning, emotions, values, and reflection and reflective practice in the daily practice of any professional for the benefit of patients and the community. So this is what I think about professionalism. But at the same time, I know that professionalism means different things to different people and they see the different aspects of it. Thank you.
So I feel that we can expand it further, that it's not just we're talking about the mannerism, but we're also talking about other things. And we start learning about ethical practices and etiquette and mannerism right at mother's knee. That's the first stage. When we're born, we start with certain things. We learn etiquette and mannerism. And that then multiplies and expands over a period of time. And when we become professional, those things which are ingrained into a system like adab, tehzeeb, mannerism, cultural values, religious values, all those factors combined together amplify at the stage when we enter a medical school or a nursing school or physiotherapy, any health service. So then it's that's just the thing that's grounded in our nature. It becomes a part of our habit that is amplified, and in a way, from a granular state, it becomes more complex as we learn from our teachers, our role models, which is a very important thing. I'd like to discuss about role models as we move on. What is the value of role model? And then curriculum, and then the hidden curriculum, and all those factors combined together. And I think, in my view, most important thing is that we learn from each other. We imbibe values and practices and habits, etc., from our colleagues in the profession. All along the way, you learn from seniors and juniors, and that combined together gives you the attribute of professionalism, which cannot be defined in one word. It's a complex thing. It carries many values. And let's see if Gauhar would like to add to that.
Yes, sir. Thank you so much. As you have said that it's a complex construct which carries many attributes to be incorporated in the definition of professionalism. So what it means is the tacit knowledge component, which is not explicit, rather implicit knowledge component of professionalism in the profession, then is contextualized to which society and culture we are talking about. And it makes it difficult to have a universal definition of professionalism. At the same time, it provides us a room and opportunity to contextualize professionalism to a particular culture. So my interest will not be what is the global definition of professionalism, as long as the definition that belongs to a culture is based on the principles of medicine that are lifelong, learned over centuries, and those principles are not compromised, we as educationists are always flexible to accept any definition of professionalism that is adopted by a particular culture or a society.
It's very interesting you talk about culture. I mean, there was a time in my earlier days, I've been around for a long time, I used to study cultural anthropology. And in fact, though, once upon a time, I was doing anthropological studies of the basis of diseases in the ear, that is otology. And I discovered a lot of things. I traveled extensively in different places, and I found that culture not only impacts the values, professional values, but also affects the disease, and that's a different thing altogether. But coming to the values, what is important is that physicians or health professionals who travel across the world, and the world is a global village, you have to understand the values, the norms, the practices, and the culture where you're practicing. Otherwise, it can create a lot of controversy and difficulties. And I can tell you an experience that you learn from UK. UK has become a melting pot of many cultures. And it becomes quite difficult. And we saw during the COVID era when people were dying of multiple faiths or without faiths, the question of burial or disposal of the dead bodies created a lot of ethical dilemmas. In the first few weeks in December or January of 2020, I remember that the priest and or the parson or the mullah, they all struggled because they didn't know whether you could touch that body or not. Everybody was scared. That was a major ethical dilemma, and it definitely compromised certain professional status. I remember one of my friends who was a general practitioner, he could not care less about the disease affecting, etc. He jumped into the water and eventually perished. But such are the moments when you learn that culture and religious values and faith values or the practices carry a lot of weight in decision making.
Yeah, very right, sir. Let me add on to it. See, as I said, that the without compromising the principles of medicine, if we can adopt the definitions to the melting pot of UK, even the definition of professionalism can be dynamic. For example, the definition of professionalism, even within the UK context, that was prevalent maybe 40 years, 50 years ago, and if it changes today with the changing societal context, that would be perfectly fine. So that makes the job of educationists more difficult to keep in view that professionalism is, as doctors have a societal contract. Doctors carry some kind of social accountability to the societies. Then in this context, and then there is heavily transformation of medical education in terms of digitalization, as we have seen. Then we have seen the impact of COVID-19 pandemic on the people and the way confidentiality is being practiced these days. So as long as what we call the principles of medicine in terms of that the doctor should be altruistic, the doctor should have certain levels of empathy, the doctors should have excellent communication skills, there should be confidentiality practiced. If the principles are not compromised, how the way these principles are practiced to make a doctor more professional is where the contextualization and cultural variation takes place, and that is perfectly fine to have any definition, ingredients, the values, the norms that are carried in a particular society. It is perfect to accept any definition.
Thank you, Professor Gaurav. And let's turn to Professor Yadullah Zarezadeh, sir. How do you define professionalism?
Sir, I think at the beginning of my introduction, I defined my definition of professionalism as the habitual and careful use of communication, knowledge, emotions, and clinical reasoning and reflection in the daily practice. But let me add something to what my master said about the impact of culture. Specific negative or positive cultural components, I think there are in terms of professionalism. There are always some elements of in any culture that negatively or maybe positively affect professionalism of the professional doctors. We must be aware of such components of our culture and in our society and correct them in our work as we are the role model, as Professor Shabir said, for others. To do this, we need to enhance our cultural competence and our cultural awareness, I think. I would like to talk about cultural awareness of the doctors and professionals as well in this discussion. Maybe you can add something to it. But I think cultural awareness is important, and there are some models for it to how to increase, to enhance, for example, my own cultural awareness. This is important as well.
Thank you, sir. Maybe if you can talk about the professional identity
I think
information.
if I can pick up a couple of things that Professor Gaur Wajid said, and he highlighted several things in this brief statement that he started with. I think what you were talking about was certain important factors like communication skills, which is a very important factor. And I think apart from demeanor and your attitude, communication skills play a very important role in health profession. One. Second, you mentioned about confidentiality and privacy, which is of immense importance, particularly when the digitalization is taking place. You also talk about the digital. So there's several components which are coming out of your brief talk, Gaur Wajid. So let's discuss these important things, and then we'll talk about certain other practical things like patient-physician relationship. So let me start with communication skills. My view is that communication skill, I think, has become immensely important in the modern age. There was a time we were just taught very basic things in medical schools that you talk to the patient like this is etiquette and manners. You say good morning or salam alaikum, whatever, and you treat the patient like this. It's not anymore. It is much more than that. It is the art of your communication, how you present yourself. And it's the art of listening to patient. Communication skills in medical professions start from the listening attitude. You should be a patient listener. Let the patient ventilate. That's important. And those communication skills are unfortunately not taught in medical schools that I know of. You have to learn through workshops and things. So art of listening patiently, empathy that God mentions is an important factor, which is totally different to sympathy. And we like to differentiate between two things. Then within the element of communication skills, the confidentiality and privacy. And I must explain that confidentiality is totally different to privacy. Privacy is the individual space that even husband and wife have separate from each other. That individual space is your own personal space. That is different to confidentiality. Confidentiality deals more with your data, your information, your health, etc., etc. So all these factors there we need to discuss, and I'd like Gaur and Yadullah perhaps to explain it more. And then we'll talk about patient-physician relationship that Mubashir just pointed out a moment ago. Over to you, Dr. Zaruzadeh and Gaur.
Yes, sir. I think you asked me about professional identity formation,
Yes.
Dr. Iftikhar.
Mubashir?
Yes, Professor Yadullah Zarzadeh.
Okay, let me once again go back to the definition. Identity formation can be identified as the attitudes, values, knowledge, beliefs, and skills that are shared within the profession. So if we look at these terms like value, knowledge, belief, and attitude, we see that they are very intangible. We cannot see them, we cannot touch them, we cannot get them. So we will have some problems with assessing them. This is the main problem that I think we should note. This is not something that we can develop overnight. Let me tell you about myself again. I have been working and teaching in the profession, I told you, for more than 30 years, and I feel I am still struggling with some components of professionalism in myself as a professional. So I cannot expect a young professional to obtain such maturity overnight or in a short time. This is very important. But there are levels of professional identity formation, and it has been identified. We know about it, and it can help us to, when we are assessing professionalism, when we are talking about professionalism, we must have a consideration about that. There are models, but one that I like more is that it has divided professional identity formation into 5 consecutive stages. In the stage 1, the professional is aware of existence and importance of professionalism. This is important, and we see it at the beginning of the career. And until level 2, demonstration of professional attributes, as was mentioned in the discussion, in routine situations, in simple situations that is being repeated every day. And at level 3, demonstration in the complex situation that needs reflection, that needs decision making. And in level 4, you see a professional that can predict and can recognize potential lapses, potential dangers, potential risks for himself and for others. And at the highest level, which is the level 5, they can coach others to meet professional standards. So there are a continuum. It is familiar, and it is similar to what Banner in her 2 consecutive article in I think 1982 and 1984 it was, from novice to expert, that she told us that identity formation and growth of the professional is on a continuum that it goes ahead over time. So yes, there are levels of professionalism, and it has implication for us as teachers, and it has implication for us as assessors of professionalism. We need to be aware of these levels to design assessment and to interpret the data and the data we are gathering. I think professional identity formation is something that is going on even in myself. I am at the end of my career, I think, because I have been working for 30 years, more than 30 years, but my professional identity formation is, I think, continuing. Thank you.
Thank you, sir. Over to you, Professor Gohar Wajid, the question posed by Professor Shabihat Azadi.
Yeah, very interesting. Let me take it from the perspective of professional identity formation. See, typically in a medical college, we get a student who has completed his education in the school environment up to grade 12, or in some cultures, grade 13. This is the raw product that we get in a medical college. And in the 5 to 6 years of medical education, the curriculum is designed towards creating a medical doctor who is technically competent to perform the core technical skills that are attributed to a doctor. Now, these are, let me call them, in the domain of clinical skills. Then at the same time, we have these 5 to 6 years of time to transform this doctor into a competent professional as well. So if I may call these skills as, let me call them for the time being, as non-clinical skills. What does it mean being non-clinical skills? That the doctor should not only be technically qualified with clinical skills, the core skills, to treat a patient, but at the same time, what we call important, that it is not important that you are treating the patient. It is equally important on how you are treating the patient. So that how you are treating the patient is the component that attributes to professionalism. Now, if we have agreed that professionalism is a competence and all doctors should be competent professionals, it means that in our list of competencies that we want to see at the end of 5 or 6 years of training, we need competent professional doctors. At the same time, there are other competencies, for example, leadership, competence of leadership, so doctor should be a good leader as well. So out of these list of competencies, if we break down the skills or the attributes that are overlapping and that are required for maximum number of competencies, then these are the attributes or characters that we must see in a doctor. I'll give you, a doctor should have communication skills. Now, communication skills is important from professionalism perspective. It is important from leadership perspective. It is important from history-taking perspective and from many other perspectives. So, communication skill goes as an attribute. At the same time, if communication skill is an overlapping attribute, I would call negotiation skills, I would call conflict resolution skills, I would call self-regulation skills, on how do you regulate yourself. I would call, once you start regulating yourself, people's management skills. How do you regulate yourself with the relationship with the people? So is it possible without having the basic cognitive skills? No, then cognition goes in. Then is it possible to know about cognition without knowing about metacognition? Not possible. So every student must be aware of his metacognition skills. Then once you have done with cognition and metacognition and regulation, then there comes a step of where you are at the level of what we call emotional intelligence. And then emotional intelligence is the precursor for leadership. So this set of basic core attributes, once it is identified, that overlap with the competencies that I have told you, this makes a good start to integrate them in any curriculum to get that professional doctor that Professor Yadullah is saying we have six years to transform a medical student into a professional doctor.
Can I ask you to elaborate further this terminology of metacognition, please?
Metacognition, typically we use the terminology. I give a very simple example. If I ask you, let's go and walk for 1 kilometer. If I ask, we have how many participants right now?
50.
How many participants? 35, 37?
49, 50.
49 participants. So if I ask all 49 participants, let's have a walk for 1 kilometer. So how many of them, they would immediately do the analysis, and maybe 40 of them would be ready to have a walk with me for 1 kilometer, because they will analyze their physical capacity on how physically fit they are to have a walk of 1 kilometer. If I ask, no, I'm going to go for a walk for 2 kilometers, it means I know my physical strengths and I know my physical analysis. I can walk for 2 kilometers. Maybe 3 kilometers, again, analysis would be done whether we can walk or not. Similarly, metacognition is the cognition on top of what we call cognition, where you analyze your own cognitive capacities to find out what are your cognitive strengths and what are your cognitive weaknesses that you need to work on. I give you a very small example. My metacognition, it shows me that I have short-term memory problems. You ask me what happened in the meeting yesterday, I might get blank for a moment. Then I will need probably a minute or so to recall and give you a summary of what actually happened yesterday. So that's my metacognition that always tells me that I have this problem of recalling, but in the short term. Then another example could be that I know that many people have also told me that your analytical abilities are pretty good. What does it mean is that if you ask me to analyze some situation, I rather sometimes tend to do over analysis that is not even required. So metacognitively, you need to know on how much analysis you want to do for a given situation that is right to that particular situation. So knowing about your cognitive abilities is what we call metacognition.
So can I translate it in ethical terms, because we talk about etiquette and mannerism. So there is a word in ethics when you read about philosophy of ethics. There is a thing called metaethics. Metaethics. And I think if I relate to your discussion, ethics, of course, we know that doing good, right, is ethics in medical profession, or otherwise also do good, forbid evil. That's it. Metaethics is what is good by itself. So, in fact, when you talk about, as I understand, metacognition, metaethics, you want to go to the root cause and the root of that particular thing. So when you say doing good is good, but what is good? Is good meaningful? Is good
Absolutely
really useful? That is what metaethics is. And I think that's what brings me to the subject of virtuosity, because we all talk about professionalism, and Yadullah mentioned about the character. My feeling is that, and this is what everybody seems to say, that we're admitting students at a very early stage in medical schools, at the age of 17, 18, the mind is still growing. And that is where the job of character building of teachers comes in. That's where the role models come in. And that is where I think the question of virtue ethics comes in, that doing good is good. But what is good by itself, and how do you become a virtuous person? I've written written a chapter in the book that's coming out on virtuosity, the virtuous physician. Our objective as physician teachers should be that we produce virtuous health professionals. What is a virtuous health professional? It has all the qualities that you just mentioned. His character is good, his personality is good, his communications are excellent, he's a good academic leader, he's got empathy and sympathy both. And above all, he's professionally competent. He should know his limitations. And that is where the question of work ethics comes in. Work ethics is a part of professionalism. Like, you should know your limitations. If I'm an ENT surgeon, I can't do everything. So I must know where my limitations are. Especially in the General Medical Council in the UK, there is a characteristic appraisal form. You have to write, you do so much and not beyond that. Because if you're doing something excessively which you're not trained or competent enough, you're being unprofessional. Now, that's a practice that in the developing countries is very common. And we need to discuss that sometimes. The other thing that's important in character building, in my view, is the honesty and integrity and truthfulness. Telling truth is the fundamental rule of medical communications. But sometimes, and within brackets, withholding truth is more beneficial than telling truth. Like in a culture, and we talk about culture sensitivity, an elderly person comes to me from Asian background, and I'd send a biopsy, and the biopsy is positive for cancer. The question is, should I tell this patient exactly, he's 90 or 80-year-old person who's got bronchial carcinoma or oral cancer, should I tell him the fact or should I withhold? Because if I told him the fact, he might collapse. Withholding truth, I think, sometimes is beneficial. And I'm bringing you to the discussion of the fundamental principles of ethics, that is autonomy, beneficence, non-maleficence, and justice. My personal view of reading ethics for the last 25, 30 years is that autonomy is not the first principle. It is the beneficence that's more important. Autonomy is more relevant here in the Western culture where everybody's individual. You take a decision. In many other cultures, the decision is collective, taken by the family. So beneficence takes priority over autonomy. So I'll have your views, and I'll admit somebody who's waiting to come in. Over to you for discussion.
May I add something to what Professor Gohar said? I'm worried about a misconception that may arise here because we are talking about professionalism and we are talking about many attributes and competencies, and someone may think as a university lecturer that we want to add to the curriculum something that we call it a curriculum overload. We don't want that. Professionalism means something that must be in the atmosphere of medical education everywhere and every time, and even on the stairs, in the elevators, in the classes, when we are talking, everywhere. So it is something that must be in the spirit of medical education, must become the culture of medical education, rather than, for example, just putting some units, adding or some units or some lessons to talk about it. It is good, but it's not the aim. The aim is creating the culture of professionalism, the spirit of professionalism, and the atmosphere of professionalism in medical education. I wanted to add that because when I talk about professionalism in my school and in Iran, that misconception arises immediately.
Absolutely. If I may add here to take the discussion one step ahead, right now there are about 190 medical and dental colleges in Pakistan. Maybe there are about 75 in Iran. This figure alone signifies that we need to have our own explicit definition of what kind of professional doctor we want. Now, it has to be based on ingredients because professionalism, as we agreed, is a competence and it has to be broken down into its components. Now, of those thousands of doctors that are under the process of being medical students being transformed into doctors, if Iranian Regulatory Council or the Regulatory Council of any country that defines on what kind of professional doctor we want, there are certain ingredients that will automatically go in any definition. For example, are there two opinions that we don't want doctors who are not altruistic? Accountability will be added into your ingredients of making the concoction of professionalism. Excellence has to be there. You can define excellence in whatever the way you like, but it has to be there. Integrity has to be there. Honor has to be there. How do I define honor? For example, my honor definition could consist of being fair to the doctor, to the colleagues, patients, and society, being truthful and straightforward. Then dutiful. A professional doctor has to be dutiful. He has to take responsibilities of what he is doing. Then respect to others, to all stakeholders. Now, if these 6 or 7 attributes, we identify them, that this is what goes in our definition of professionalism, then comes the next step on what quantity you want to put these contents into your concoction. If you are cooking something, maybe you add a pinch of salt only. You add a pinch of spices. You add a lot of rice. You add a lot of water. You add maybe some mutton if you're cooking some dish. So the quantity of ingredients it might vary into when you are making into the process of making a professional doctor. How to make it then, how to cook is equivalent to what we call how to teach and learn professionalism. And as Professor Yadullah has very rightly said, that it has to be integrated into the curriculum right from day one,
Yes.
and then continuing it till the doctor passes out. Unfortunately, one of the myths that is associated with professionalism is that it is something that pertains to clinical years. Then how to teach professionalism to preclinical students? No, professionalism is not clinical. It has nothing to do with clinical or preclinical. It has to be incorporated in the culture right from day one. I give you a small example. A medical student who comes habitually late to the class, is he going to be a good professional? Probably not. His behavior needs to be transformed. A medical student who tells lies, who is not respectful. So respect is not clinical respect or preclinical respect. Respect is respect. So that is attributed right from day one, whether a student is respectful or not. So the culture of professionalism has to be incorporated in the medical colleges right from day one in a very structured manner.
I would go back to my definition that professionalism or etiquette and mannerism, not professionalism so much, etiquette and mannerism, they start from your birth, right after birth. You learn the first step from your parents, then they tell you what's happening, how do you. So you're absolutely right. It's not clinical or clinical. We're talking about a virtual, a good human being. A good health professional has to be a good human being before he becomes a good health professional. You're absolutely right. You cannot say clinical or preclinical. In clinical cases, of course, it's more amplified because you're talking about health professionals. So the ingrained or the atoms, the molecules that are built in your system, you have to start from day one, from your home, then the school, then the college, the university, and you learn from peers and scholars, and that is where the importance of the role models comes in. If you have a good role model, this is a very common thing that you see in the UK because the families are breaking down. There are no role models. And what you see on the streets here, the crime, etc., is because there is no role model. If there was a role model, and that is where I feel very strong about it. Autonomy has certain value. But what is important is there should also be an element of authority. Because if there is a family, there should be some authority. When there is no authority and you talk only about autonomy, what is happening is a disaster of a community, disaster of family unit. And that brings me to the topic which I would like to dilate further upon, if Mubashir will allow me, on work ethics per se. But before that, let me just talk briefly about the clinical application of professionalism. When you have a patient who comes in, obviously you get up, etc. Everybody know, I'm not going to repeat that. But there are 4 models, and I'd like the discussion to revolve around these, if you'd agree. Professional models in healthcare. The first and foremost is paternalistic. And this has been a tradition for a long time, that doctor knows it all. We learn from our elders and seniors that, don't say anything in the villages, even now in Pakistan, Iraq, and even in the UK, doctor knows it all. So doctor had the authority, and it was moral obligation, therefore, to be honest and fair, take and make the best decision. But when the knowledge exploded because of technology, etc., that paternalistic approach had to be cancelled. The doctor does not know it all, because the patient comes with all the data through the internet. What is tinnitus and what can it be caused by cancer, etc. So then you had the other model, informative model, where the doctor gave all the information about the results of disease, etc., and the decision has to be made jointly. The third model was deliberative model, that you deliberate upon the conditions, the clinical, the history, the clinical examination, diagnostic, etc. And then you come to a decision. A contract had to be drawn, we sign, not as a health worker, not as a doctor, but as a health worker. And the patient is not a patient, but a client, because of litigation. And then, of course, there was this model, which is my favorite model, where you sit together, doctor and the health worker and the patient, like a family. and you discuss the good and the bad points. What are the alternative therapies which are available? How do you decide the prognosis? What is the best? You also look at the factors, socioeconomic factors, because it has to be holistic. Medicine, as we all know, has to be holistic. These are models. But in work ethics, there are many other elements come into application practice. Like Yadullah pointed out earlier on, and we discussed it briefly, that you should know that you're not creating any difficulties in the environment, etc., the climate you're working, etc. Whistleblowing is what I'd like to talk about. Whistleblowing is a very important factor which has gained huge importance in the recent times. Let me have your opinions and we'll discuss it further. Dr. Zarizadeh, are you there?
Over to you,
There might
Professor.
add something to
Can
Dr.
you ask me?
Iftikhar, would you please
Yeah.
guide the question? Yeah.
Yes.
Can you-
So,
Yeah, go ahead.
yes, sir. You can explain further about whistleblowing.
Well,
just
whistleblowing
I wanted.
is an important thing because this is the cultural problem. This is happening in the UK a lot. I'm sure it happens in other places. What happens is that if you're working in a climate where you know your colleagues, etc., but you also know, you feel that there is a certain person who's not doing the things, the items, the services, the professional, whatever is needed according to the standard, and you feel that there's some deficiency which is resulting in a poor outcome and happens over a period of time. Keep observing it. You observe it and observe it and observe it. That so-and-so person, you don't talk to anybody, you keep it to yourself. But there comes a time when it spills over. There comes a time when you feel that this particular person is being unprofessional, not delivering the goods like he should, and is trying to either hide his incompetence or her incompetence or whatever. And then you have to come to a decision. Who should you tell? So this is where the whistleblowing comes up. Whistleblowing is a very common thing and one has to be careful. Because if you blow the whistle, you might be in trouble. And lots of people, because the fear they might be victimized, they do not expose the weakness of a colleague, which is again very important subject. Should we disclose the weakness of a colleague? Is it a professional thing or unprofessional thing? My view in this is that you talk to the person himself, that this is what I feel about you, that your deficiency is obvious in certain things. Either you should go and train yourself or let the authorities or senior person know that you cannot do these things. So you accept it. Being magnanimous is much better than being miserly in such matters. One should be careful. And if at all comes to the question of whistleblowing, because you have to save the patient from the harm, which is beneficence, you go and talk to the manager or senior person. And then this is what's happening in the UK. I like to know what's happening in other cultures. Perhaps you can start with maybe Iran, and then we go to Egypt and Middle Eastern countries and Pakistan. Is whistleblowing a common thing? That's the question.
Over to you, Professor Yadullah Zarizadeh.
Just I wanted to ask something about how to integrate professionalism in the early years from the early years of the medical education. In Iran, we have devised some lessons called Adab Pezeshki, means mores of medicine. In that lesson, we talk about the essential or characteristics, customs, and conventions of medicine as a community of practice. And then we have medical ethics, and then we have professionalism. So we have three consecutive longitudinal steps that we take. But I know it is not enough. It must go even further to the culture and the atmosphere of medical education. Then in Kurdistan, I have emphasized on role modeling, as Professor Shabih said, because as I mentioned, the students are not learning only in the classes and in the hospital wards. They are learning everywhere, and we are their role models. So it is very important, and the importance of reflection, because reflection and role modeling are the main tools that we have to promote professionalism in our students. So I wanted to add that, and back to you, Mubashir.
Thank you, sir. Over to you, Professor Gaur Wajid, regarding Professor Shabi Haidarzadeh's comment of whistleblowing.
I will add a couple of points to what he has said. When it comes to, I will give you the example of WHO. There are very clear policies and rules for whistleblowing on what steps a whistleblower should take and how he should proceed with if he wants to draw the attentions of authorities towards a particular issue. Guidelines are there and they are very clear. How there is an undermined culture of whistleblowing in developing societies, I would attribute it to the weak regulatory environments in most of the developing countries, especially when it comes to healthcare arena. We do not have those kind of regulations that can actually protect the rights of whistleblowers, and neither whistleblowers would understand the dynamics on how should they act within the accountability and the responsibility frames that are inherently associated with the phenomena of whistleblowing. So you might find that people might end up on personal victimizations, even taking the help of social media. And you know that I won't hesitate saying that even 90%, up to 90%, I'm just giving an arbitrary figure, there is no evidence. We can say that predominant amount of what you find on social media is just fake news and disinformation and misinformation. Why is it so? That is because we do not have pertinent regulations that can push the persons to feel responsible of what they are posting on social media. They are also accountable and responsible for their own actions. Neither the regulations are there, nor there are self-regulations to take the responsibility that I am doing the correct thing. So this is one particular reason that I can say why the phenomena of whistleblowing is not common when it comes to developing cultures like our economies. How to strengthen it? I would say the underlying factor is the regulatory environment. The more and more the regulatory environment you strengthen, you have pertinent laws, rules, and regulations where people know that if I get caught into where the charges are framed against me, I am going to be penalized. Then we can see that whistleblowing as a very pertinent, potent tool, it will emerge in these societies as well.
Right. Thank you so much, Professor Gaur Wajid. And I would like to post another question to you regarding the role of different stakeholders in defining and institutionalizing professionalism, if you may elaborate that.
Yeah, so as Professor Yadullah has said, how to integrate professionalism in our curricula, and as I said that we have 5 to 6 years of curriculum to transform actually a raw student into a health professional, whether doctor or being nurse or any health professional. Now we get into the process of defining what should professionalism mean actually in a particular context and society. Once it is defined, we get into the and at the level of defining and conceptualizing, what ingredients exactly go in the definition of professionalism, how it would be taken, the roots of it has to be drawn by taking different stakeholders in confidence. For example, if you take the definition of professionalism from the lens of medical professional, he will define it in his own way. If you take it from the perspective of a patient, his definition of professionalism would be quite different than the definition of a doctor or a nurse. If you take it from a government perspective, the government may define it in a different manner. Healthcare regulators may have their own definition of professionalism. So if there is no unified definition, if you do not have the different stakeholders sitting on one table and agreeing upon one definition, your job of institutionalizing professionalism will become extremely difficult. So all stakeholders must be taken into confidence to come up with a one uniform definition of what do they expect from a professional doctors to behave once he passes out and gets into actual practice.
Right. Thank you so much. And if Dr. Professor Yadullah Zarzadeh, you want to add to it?
Yeah, yes, just a little bit. When we are talking about stakeholders, students are one of the main beneficiaries and stakeholders here. And I think they have got a very important role themselves. We must tell the students that you have got a role of making yourself something out of yourself, out of your time and education that you have got. In my opinion, it is very complex. There is a sculpture, self-made man sculpture by Bobby Carlyle, I think. There is a man who is making himself. So the creator and the creation are the same thing. We should teach this concept to our students that you are someone who, with our help, our contributions, you are making yourself. So, and we must give the students a role model, an image of themselves, and help them to create themselves a good doctor, for example, out of what they are now. So this is one of the roles that I wanted to add. Thank you.
Right. Thank you so much, sir.
Moshe, if you permit me, because of time, I thought
Sure.
we need to cover a few things that came up, and conflict of interest is a very important thing in professionalism. So we'd like your opinions about conflict of interest. Also, interprofessional relationship, professional jealousies, abuse of power, harassment from the hierarchy. These are practical things that we see. And also I'd like to know and discuss, if you would, the financial arrangements between different, like for example, you have private practice and you also have a state job, a government job, etc. How do you allocate these, how do you differentiate between these financial arrangements, etc.? Because there are ethical issues that come up. It's a major problem that's coming up in the UK and all over the world, that you might use your position to boost your practice, etc. Or highlighting your degrees or your emblem or whatever beyond the measure. These are the things. Now, before we go on there is a question for you, Gaurav. Where do you get the guidelines from the WHO for professionalism? Perhaps you can write on the in the chat box, and the person who's asking the question will get it. So, my view on these things is very simple, that the conflict of interest is a major professional hazard. If you're working for an institution, you must be loyal, you must be absolutely 100% honest, and must use your professional capabilities, your professional integrity for the benefit of the institution that you're working for. If you abuse your authority or you use your personal context or whatever influence for a different authority, different institution, which is a very common practice, that, for example, the pharmaceutical industries or cath labs, etc., they come up with a gift to give you so that you can promote their product. And you're not using the one that you institute. I'm just trying to be abstract without giving the names, because this is a professional hazard that we see a lot. Sonia Shah wrote a wonderful book, which I read only last year, that how the pharmaceutical companies are abusing the medical profession in prescribing the drugs of their choice, or in cardiac surgery or oncology, promoting their products by bribing the physicians with luxurious trips or holidays, etc. That is one thing that I'd like to mention. I'd like your opinions on that to expand the discussion further. Also, harassment. If you're the boss, you're the head of the department, you're the chief, etc., you harass your juniors. Is that ethical, legal, professional? I'd like your opinions to expand the discussion further. Over to you, Gaur and Yadullah. And I think if you'd permit me, Mubashir, we should take the calls from the participants. I see about 50 people, some of them very senior.
Yes, sir. After maybe this may be the last question, then we can go to the participants to take few questions.
Yes, I agree that these harassments and medical trips by the pharmaceutical companies and their influences on health professionals, and then they deal with. But I would say that the underlying root cause is again weak regulatory practices. Weak laws, either the laws don't exist, or even if they exist, they are not practiced, and people know that they will get away by doing all these practices. So more and more the regulatory environment and culture and the accountability are integrated into the system at the level of the ministries of higher education, or like Pakistan Medical Dental Council and Iraqi Dental Council and Iranian Medical Authority. I believe that the system of accountability has to be there to curb these practices. So if I may ask Professor Yadullah to say a few words about the assessment of professionalism as well before we start taking the questions.
Yes, sir. I would like to talk about assessment of professionalism because it is important, and maybe we have got some concern as well about the assessment of professionalism here. As I mentioned in the last session that we had together about professionalism, assessment of professionalism is not something straightforward, and it is not easy. If you ask me if there is any, for example, tools and reliable tools for assessing the professionalism, I would say the easy answer is yes, but the correct answer is I am not very sure that there are many good tools to assess professionalism. As you mentioned, and Professor Shabib mentioned, and we all know, the participants know, I am sure, it is a very complex concept, and it is a very wide concept. So such thing cannot be assessed very clearly and very easily, but there has been many attempts. They have created some tools, and those tools have been trying to quantify some of the unquantifiable aspects, and they have been able to assess some parts of professionalism, but all parts of professionalism cannot be assessed very well. So let me tell you that there are many strategies in short. For example, patient opinions. They are good, but they are not reliable, I think. Observed clinical encounters, for example. You can observe everything. You cannot observe everything, I say, but you can see it only, and the observer may change their behavior, so it's not that much good. Multi-source feedback, 360-degree feedback are good, I think. They are excellent. And self-assessment. The best and the most productive one, I think, is self-assessment based on what we said so far, because in self-assessment, there is elements of reflection. There is element of growth. There is elements of seeing oneself and self-regulation after that. So I think, and I stress on self-assessment and the culture of self-assessment as one of the tools. But I think we cannot be sure that we have assessed professionalism as it should, and it is something that it will remain for debate, I think, in the future.
Can I, before I hand over to God, because God is an expert in evaluation, can I just share the experience that we have in the UK? And I have, with hindsight, the background of working in Pakistan, also Malaysia and other places, that 360 degrees evaluation is an excellent idea. What happens in the UK is that every year you have to go through a process called appraisal. And the appraisal is carried out by somebody who maybe your senior or peer or your boss or whatever, but somebody who's competent in professional assessment, who knows what professionals. It's again, it's a non-tangible thing. Professionalism, certain things you can check, like competence, clinical competence or surgical, but certain things like attitude and mannerism and behaviorism, which you've imbibed from your family, from your teachers that we discussed before, they're non-tangible. They have to be observed. And the observation has to be carried out by your patients, by your staff. So in the 360 degrees, we have this form, you have to fill up the opinion of and this doesn't have to be clandestine or hidden. It may be open. It's better if you have open, because that gives you the time to self-reflect and improve. And then once you've filled up that form, which is a very extensive form, that you sit with the appraiser right across the board, doesn't have to be face-to-face, could be visual or with video, etc. And you go through every step of your attitude, your mannerism, your behavior, your cultural sensitivity, your religious or faith, etc., respect, human dignity, all the factors we've discussed, confidentiality, privacy, lack of interest, conflict of interest, resolution of conflicts, etc. All that is given. You have to do 25 courses every year, every clinician, to earn the license to practice. And then towards the end, the appraiser and you sit and discuss what are your weaknesses and what are the targets that you want to meet next year. Every year this is assessed. So if you fail to meet that target, it's not a crime. You say, all right, I'll go back and try to improve it, my deficiency. And you go back next. That process continues for a length of time. And we have some people in this group who are more seasoned than I am. They can discuss with more. Now, Gaur, you have written you gave a talk on assessment and evaluation webinar that I've liked it very much. Do you have anything that you'd like to add? Certain things you mentioned, that particular webinar about assessment of evaluation and professionalism.
Yeah, in addition to what Professor Yadullah has mentioned, I am personally a big admirer of portfolios, which are heavily underused, I would say, as an assessment tool in our educational system. And nowadays, we call the term what we call e-portfolios. So I believe that e-portfolios can be used as an excellent tool for all kinds of non-technical soft skills, for example, leadership and professionalism, etc. In addition to clinical skills, they can be used, if used well, they can be used very effectively because they provide you an opportunity to strengthen your formative assessment system, which is, by the way, pretty weak in our educational, because there is heavy focus traditionally on summative assessments at the cost of formative assessments that are not used effectively. So I believe that portfolios, teachers should be trained on how to effectively use portfolios, especially for soft skills.
Another thing that I wanted to add, if you permit me.
Yes, sir.
Is the role and the quality of the assessors. Frailty of human mind and presence of human biases, we should be aware of that as human. This is one thing. Knowledge and skills of professionalism and assessment, because assessment is not something easy. It is a very complex issue itself. And the ability to remain positive when finding something negative is very, very important. Our students are those people who will replace us. So we must remain positive about them. We will find negative things, and we should remain positive. This is very important, and precision shouldn't be expected at all. Thank you.
Thank you, sir. And I think that we can go to our esteemed attendees to ask if they can unmute themselves and ask a question, or they can post that in the chat box and we can read it out. So if anyone wants to directly ask our esteemed presenters, please unmute yourself and ask the question.
I see Mr. Ehsan Zaidi, a senior surgeon from London, in the group. Maybe if he can add a few things on his experience of professionalism in the UK and also in India.
Professor Zaidi, it's a very difficult subject. Professionalism starts with evaluating somebody's integrity, honesty, knowledge, and then clinical skills. In UK, all the appraisers have to go under a refresher course every 2-3 years to what they are assessing. As Professor Yadullah said, we should not be assessing or comparing our trainees with ourselves. In UK, an appraiser from medicine can be appraising me as a surgeon and vice versa. So it's the human bias, as Professor said, is always there. But we have to be really very honest. And as Professor Wajid says, reflection, reflection, reflection. Significant events. We must be very clear. There may be an inquiry against somebody, but he should himself admit what are the lessons learned and then improve on it. These are things which we do every day. I'm due for a refresher course next month. I appraise something like 10, 12 senior consultants in my trust. And I have to, shed off all the bias, whistleblowing, all these things, they come into picture. But one has to, it's a human nature. The human bias is always there. But you're not actually going to appraise somebody who you are very close to and you will use that bias. It should be an unbiased, appraisal and recommendation. A thing to improve that, you are not condemning somebody, but you're reflecting that next year maybe it will be much better. Numbers don't count. It is the quality of the work you're doing counts. That is my humble opinion.
One more thing I'd like to ask you, Dr. Ehsan Zaidi, is the medical defense, because when I go to Iraq, or I've seen in Pakistan as well, there is no defense. I remember, and I mentioned it last time also, that I was sitting with Muhammad Saeed Abdul Zahra, who was the dean of Kufa University, and I think he's in this group as well. We'll ask him that a surgeon who was sitting there, he said that they don't operate on a lot of patients for the fear that if something goes wrong, there's nobody to protect them. And the tribes, the clanmen will come and pick them up and beat them up. In fact, some gynecologists have suffered. So I'd like the opinion of Sayyid Abdul Zahra, who's the former dean of Kufa University, on that Iraqi experience, and also Badr al-Mustafa, who's from Saudi Arabia. Their opinion would be invaluable on the question of professionalism. So over to Muhammad Sayyid Abdul Zahra first. Please unmute yourself. In the meantime, Ehsan can tell us more.
Absolutely true. Surgeons don't operate if they are frightened that there'll be an inquiry. Not only in Saudi, I've worked in Saudi Arabia, so I know people just pass the buck on to another surgeon or to another department. It's a very valid, problem. In UK, as far as the NHS patients are concerned, we are all covered with an indemnity from the trust. The private patients are covered by other insurances and Medical Protection Society, etc. But it's a very valid and a very valuable question. People don't operate when they think the patient is not going to do well. In Saudi Arabia, I learned, there were many good surgeons who won't operate because of being prosecuted. And in Saudi Arabia, as you know, if you have one inquiry, I was actually, very coincidentally, I was the mufattish for 6 years in a hospital in Saudi Arabia. And I did not sort of punish anybody, because there, if some case goes on, your leave is stopped, your passport is taken, and you cannot go till that inquiry. In my 7 years of tenure, I did not, sort of fine anybody. And I always said that this can happen to anywhere in the world. Now, Saudis are much more advanced, and these things they face. Even Saudi surgeons are having the same complications. So they have to be very open-minded. To err is human. I quote one of my boss's quotation: never believe a surgeon who says he's had no complications. He's either telling lies, or is blind, or has not done enough. That is my teaching, and I teach my students. Thank you.
I was just waiting if Saeed Abdul Zahra can unmute himself. I'd like to know from him. Are you there, Professor Saeed Abdul Zahra? I don't know if he's there or not. Badr al-Mustafa, would you like to add anything?
Shukran. Thanks a lot, Professor Zaidi, and thanks for all. I enjoyed really the discussion, and I guess that I do agree with all what had been mentioned regarding whether it is the definition or the characteristics of professional doctors or medical staff. However, I guess maybe we all agree as well that putting it in real practice is the issue. And rooting it in our young professionals or young, I would say, doctors or other medical staff is highly needed, especially in this era of the global approach of things. We used to learn our norms from our parents, from our close society, which is not open for media and so forth. Nowadays, we are not teaching the norms ourselves only, neither our neighbors or the district that I'm living in, but more likely that my grandkids are learned by the laptops and the tablets and iPhones, and so forth, and all these plays and to determine what is the norms that we have to follow, and definitely the norms that do exist in one place doesn't really fit in the other place, even the same profession. Even for being a doctor, it would be I've been trained in many places when I was young. In UK, it might be something is very legal and it is a must to be done. But in Saudi Arabia, it will be very strange to be applied, and so forth. And even in the same country, one region will be different. So I guess that how to put that in practice is the major question that we need to play for, and we may go for and discuss it. Shukran. The other issue I agree with the doctor just mentioned about Saudi Arabia, how they are progressing in applying it. And I would tell that it is not only it is the legal applications. And we know that we are having, for example, as Muslims, we are having Quran, but we know by heart that Quran has gone hand in hand with Imam who applies that Quran. So if we agreed on the definition, okay, it can't be really put in practice without Imam.
Thank you so much, brother.
Thank you.
I hope you're keeping
Thanks.
well, and I hope you're enjoying our courses. There are lots of other courses in the pipeline that you should join us.
Hopefully.
Over to you, Mubashir.
Right, so there is a question by Dr. Prashant. He's asking, what are the ethical perspectives of failing a student for the lack of professionalism? Where should we draw the red line? Over to you, Dr. Gohar Wajid.
I will get back to Dr. Prashant's question later, but let me add on to one more point to what Dr. Badr has mentioned. Yes, for Muslims, then the cultural practice in any Muslim society, we may have a very distinct definition of professionalism that draws our roots from the religious values that Islam has given us. And this is exactly what would our society be expecting from us as well. This reminds me of one of my colleagues and my students. If you may Google the 4 gates model of Arabian medical professionalism. The 4 gates model of Arabian medical professionalism. This is medical professionalism in the Arabian context. Dr. Iraqi was one of my students who finished his PhD from Maastricht University. And as a part of his requirement to complete PhD, he had to publish 3 papers. Now, one of the papers, we presented a model of professionalism. And I was a supervisor. There were supervisors from Maastricht University who were Christians. And when we presented the model consisted of 4 gates in the form of 4 gates. The first gate was dealing with self based on self-accountability, that is taqwa, and self-motivation, that is the concept of ihtisab. Then second gate was dealing with the task, respect for patient keeping, professional confidentiality. The third gate was dealing with others, excellence, and commitment towards professional development and reflective practice. And then we added the last gate after great discussions. Now, this is where our Christian friends were not into discussions, and I was sitting with Iraqi discussing all these things. And the 4th gate was added was dealing with God. And that was self-awareness, recognition, own potentials, and self-management, balance between persons and societal roles. The concept of accountability. I am accountable to myself because of my religious values. Now, when the paper was written and presented to our Christian counterparts, and they were not used to seeing God into academic discussions, they said, where did God come into this discussion? And they were very skeptical to adding the 4th gate to the model. But we insisted that no concept of professionalism can be complete without having these religious values incorporated in the model. So eventually they had to agree to us, and that paper was eventually published in Medical Teacher. You can actually find it if you just Google the words, you can find the 4 gates model of Arabian medical professionalism. So that's how we contextualize professionalism varying from culture to culture. Now, coming back to the ethical perspectives of failing a student for the lack of professionalism, if I may ask the participants, would you like to pass a medical student who is likely to have unsafe medical practice? Would you like to pass a medical student whom you think is not going to be a professional and put the whole field of medical professionalism? We are all medical professionals, and we have certain obligations, responsibilities, and accountability towards protecting our profession as well. Because this is the profession that is providing us our daily living and risk and our livelihood. So shall we allow a medical doctor who is unsafe medical professional? Now, our assessment system can be flawed. We might have low validity of the assessment system, but we in principle cannot allow a doctor who is, by the way, excellent by his clinical skills, but is weak on professional skills. This is reminding me of one small incident I would like to mention. One of my friends about 30 years ago, he was appearing in MRCP-CH exam in UK. He came back to, I was working in Dubai those days. He came back and he was, disappointed. He said, "Oh, the doctor, I did not pass." I said, "What happened?" He said, "You know what happened?" I said, "What?" He said, "My Viva was excellent. And the lady and gentleman who were my external examiners, I had a fantastic Viva with them. The last Viva was with one of the lady examiners. She congratulated me and told me, 'Congratulations, you have passed the exam.'" Now, this was the bedside Viva on the patient. Then he said that the lady actually left from there. And I was so pleased and happy that I have passed the exam, and I was picking up all my medical instruments. And, in the euphoria of passing the exam, you can have the feeling. He said that moment, that mother of the child patient, it was pediatrics Viva, she asked me, "Doctor, can I ask you a question? I really needed to ask you." She said, in that mix of the feelings, I could not pay attention to the lady. Now that doctor was, that the lady external examiner, she was a few feet away, and she was watching it all. She came back, and this is what he quoted. She said, "She failed me." She said, "Sorry, doctor, you need to appear again. You need to really work on your professional manners." So this is how seriously it can be taken in different cultures. And I believe that we also need to pay attention to it in various forms, one or the other.
Thank you, sir. And I think it is time that we have to end the session. I would like to invite Professor Shabih Azadi to say a few last few words, please.
Well, thank you, Moshe. It's been a wonderful learning experience for me with experienced teachers and scholars, and deans and vice chancellors in the groups. Great learning from Gaur Wajid, of course, who's my eternal teacher. He's my mentor, although he may be younger than me. And of course, Professor Yadullah Zarizadeh with immense experience, all the others. It's been a wonderful experience. And I hope that this podcast will be read, listened to, attended to by other people, and will give us encouragement to do more podcasts in the future. And I'm thinking of several. We can have a podcast, for example, on professional attitude and mannerism. We can talk about learning skills. We can talk about teaching methods, assessment, etc. Lots of things. SIVU is obliged to all of you, Professor Gaur Wajid, for giving your time, Professor Yadullah Zarizadeh for giving your time, Badar Mustafa, Ehsan Zaidi, and all the others who have attended. Thank you all on behalf of Sadiq International Virtual University, and over to Mubashir to conclude it.
Thank you, sir.
Thanks
and thank you all for joining for today's discussion on professionalism, and hope to see you in our next webinar or podcast. Thank you all, and goodbye.
Thank you so much, guys.
Bye-bye.